right. Good morning, everybody. All right, so for those of you who I don't know, my name is Heather Starmer. I am the director of the Head and Neck Speech and Swallowing Rehab Program here at Stanford. And it is my absolute delight to welcome everybody today, both those of you who are here in the room and those of you who are joining us online. This is our 8th annual Head and Neck Patient and Caregiver Education Symposium, and our goal is to provide community as well as information. And so when I look out and I see people who've been here year upon year and they come back, that tells me we're doing something right. So I hope that you will also become continued attendees at this event. We do change our programming up every year to try to keep it interesting. So I think you will find the information here today to be quite interesting and the opportunity to meet with other people who've walked a similar journey to yourself. So today we are going to focus on a few different things. We're going to be focusing on those symptoms that we know are very common in many patients who have been through head and neck cancer treatment, and things like dry mouth, things like pain, and things like taste changes. But we're also going to have a bit of a focus on advocacy. And I think this is one of the opportunities that we all have as a community to try to improve this experience for anybody who goes through it. I don't think anybody sitting in this room would say, well, this was a breeze. I'd do that again, right? There are a lot of challenges that come with this treatment. And so there are opportunities for us to advocate for ourselves as patients and our caregivers. There are opportunities for us to advocate for increased public awareness. We know that head and neck cancers, many of them are preventable either through vaccines or through lifestyle modification, so increasing awareness of that to try to decrease how many people are diagnosed with head and neck cancer. And also opportunities to advocate for things like research funding that will help to move the needle on making these treatments more effective and less toxic for those people who have to go through it. So we're hoping to focus on all of these things today and providing you with different tools that you can take into your lives. Now this year our Patient Advisory Council and I talked about maybe highlighting a little bit about the continuum of survivorship over time. And we think about survivorship as something that starts at the time of diagnosis. So really from the moment that you hear that you have head and neck cancer, you are on that survivorship journey. But then we can sort of break it into different areas that have some particular symptoms and side effects and trajectories. So we all know the acute treatment period is probably the most challenging for most people, and that acute recovery period for the first several months after treatment. And then we get into sort of this post-treatment, this longer-term phase. So the first couple of years, and then we move into that 3 to 5 year where you're starting to hear words like cure from your oncologist and thinking you've put this all behind you. And then you've got the years after that where maybe some of the side effects of radiation are coming into play. So really we want to try to highlight, and each talk will highlight different parts of this continuum so that regardless of whether you're newly diagnosed or somebody who is 11 years post-treatment, there's something of value for you. So our goals today is to support excellent quality of life. We want everybody to be able to say they're living their good life, doing what they wanted to do, as somebody mentioned to me this morning, and putting it in the rearview mirror. So that's our goal, is to support that for both patients and their caregivers. And so for those of you in the audience who are caregivers, your role is critical, and what you experience is also just as important. So we want to make sure that we are providing information for both. We want to provide high quality educational material and really facilitate connections. So whether that is connecting with medical professionals from Stanford, other people who've been through similar journeys, we want to make sure that you're making those connections today. And then we want to highlight some of the services that are available through Stanford, because we know that when you're going through a cancer journey, you don't always get everything at once. You don't know exactly what the different services that are available. So you definitely want to visit with some of our tables during the breaks and talk to some of our providers. So our schedule of events is fairly packed. We are doing a lot of shorter talks to keep it easy to focus on today. But you can see our morning, we're going to be focusing a lot on advocacy from patient and caregiver perspectives. And then we're going to move into talking a lot about pain, because pain is something, again, that impacts people at all stages of treatment. And then we'll sort of wrap our morning up with a really inspirational patient testimony about hope and the power of hope. This afternoon, we're going to get into a little bit more nitty-gritty detail about side effects. So you'll see we have a few talks about dry mouth because we recognize that for most people, this is one of the big things that impacts them long term. We're going to talk about things like taste and smell changes, intimacy and sexuality, things like thyroid function, as well as how do you manage the transitions once you're done with active care. What is the oncology team's responsibility? What is primary care team's responsibility? And what should you be thinking about in terms of things like imaging or ultrasounds of the carotid, just to sort of talk about those transitions later. As I mentioned, we do have a number of educational tables out in the lobby area, so please do take a chance to meet with some of these folks during our breaks. There were a lot of people involved in this day, and I want to share my extreme gratitude to the people who helped to plan this event. We will literally start planning next year's event in about a month, so this is not something that we do overnight. This is something that takes quite some time and a lot of good minds. So I want to particularly thank Jocelyn Hamilton, Jennifer Kisner, Teresa Yao, and unfortunately neither Hope nor Lee are here with us today, but they also were involved in our planning. So thanks to our planning committee. Thank you also. Yes, let's please give them a serious round of applause. I want to also thank our event volunteers. So some of you may have had help finding your way here because it's a little bit confusing. Some people were helping with setup and sign-in. Most of our event volunteers are graduate students who are going to be future speech pathologists. So we're really pleased to have all of you here today. We really appreciate your assistance. And please take the opportunity to learn from these wonderful people who have joined us today. And then I want to thank my Patient Advisory Council. So these are the folks who were kind enough to give me some of their time by Zoom and email when I said, do you think this is a good idea? Do you think this is a bad idea? They were a really good sounding board and provided some really great insights into what would be helpful and meaningful for patients and caregivers. So thank you all for being part of the planning. And then last, I can't go without thanking Liz, and thankfully this year she's actually in the room for the thanks. Let's give Liz a very big round of applause. Liz is my right hand. She has made sure everything in the planning has gone flawlessly and done it with incredible enthusiasm and professionalism. So thank you so much, Liz, for everything you have done. And then I also want to thank financial supporters. So this is not a cheap event to put together, believe it or not. And so some of the funding comes from donors who are people who have come to this event and feel like they want to give money to support it in the future. And some of that funding comes from the Cancer Center. So I want to acknowledge and thank any of our financial donors as well as the Cancer Center. And Cliff Harris is our development officer who can help sort of make those things happen. He'll be here a little bit later today, and I'll introduce him when he arrives, so that if anybody does have interest in participating in this or supporting research at Stanford, he's a great connection. So for our virtual attendees, I want to welcome all of you and hope that you enjoy the day as well. Please feel free to post questions in the chat of the web platform. We do have two wonderful volunteers who will be manning that all day long and making sure those questions are getting responded to. And then Jocelyn will be your connection. So if something is going wrong with technology, if you send a message to Jocelyn, she'll help you try to troubleshoot it. Okay, so on the topic of advocacy, I want to highlight the Head and Neck Cancer Alliance as an organization that's designed for patients and caregivers that does really phenomenal advocacy work. and provides a lot of very helpful informational webinars. There will be a survivorship symposium hosted in Los Angeles in October. And so every year in April, in association with Head and Neck Cancer Awareness Month, the Head and Neck Cancer Alliance does a move-a-thon. So Team Stanford always participates in this. If you're interested in participating with us next year, since this year is pretty close to over, you can reach out to me and I'll make sure that we get you invited. If anybody's interested in supporting our team, you'll see QR codes on the table. But just a little highlight of some of our Team Stanford celebrations of the Move-a-thon. Larry's wonderful push-up off a couple of years ago, and then a really wonderful walk that a handful of us did last night.